So, in this session, let me discuss the questions in the parathyroid disorders. A clinical scenario, we have a 45-year-old man with the history of primary hyperparathyroidism comes to your clinic for a follow-up visit. He was diagnosed 3 years ago after a routine blood test revealed an elevation of the calcium levels. He has no complaints, review of the systems is negative and physical examination is unremarkable. His family history is negative for the similar problems. Calcium levels are elevated. How much it is? 12.5 milligrams per deciliter. A DEXA scan shows T-score of -2 at the hip. What is the most appropriate treatment regimen for this patient? So, what is the age of the patient? Right, that is 45-year-old man. Calcium levels are elevated and T-score is -2. So, T-score of -2, what does this tells you? This tells you that the patient is suffering with the osteopenia. That means there is decrease in bone mineral density and there is increase in the calcium levels. So, what is that we can suspect? We can suspect the hyperparathyroidism. But already in the history itself it tells that the patient is having primary hyperparathyroidism. The options are observation with routine follow-up visit that include assessment of calcium and as well as the DEXA scan. Start a bisphosphonate therapy. Third option, refer to an experienced surgeon for parathyroid surgery. Administer calcium 1000 to 1500 milligrams per day and vitamin D 400 to 800 international units per day. So, what is the correct answer here? The correct answer is refer to an experienced surgeon for parathyroid surgery. Why? Because this is a clinical diagnosis of primary hyperparathyroidism. What is the treatment of choice in patients with primary hyperparathyroidism? That is the surgical resection of the tumor. Now, first of all, you also need to know what exactly is the indication for surgical resection in these patients. Let me tell you the list of indications when you have to do surgical resection of parathyroid gland in hyperparathyroidism. I'll give you the list, but let me just sort out the other options also. Starting the bisphosphonate therapy. See, the first line treatment is surgical resection if you are seeing primary hyperparathyroidism. So, the best answer here is the surgical resection. Then, fourth option is incorrect. Why? Because already the patient is having increase in the calcium levels, and upon that if you administer the calcium, that will precipitate the hypercalcemia. Next thing is observation with routine follow-up visit that include assessment of calcium and DEXA scan. See, already DEXA scan shows that there is osteopenia and there is a background history of your primary hyperparathyroidism. So directly go ahead with surgical resection in the individual because the calcium levels are elevated to more than or around 12.5 milligrams per deciliter.